we're so excited with having you here with us today. And we're going to talk about the collaboration of the MEDI Monday, along with Garcia Williams, who's the executive director of the MEDI Community Resource Center. We have Mr. Terry Bass, radio personality of WJNI. And then we have all traveling, and with us today, Mr. Glenn Ellis Sr., medical ethicist researcher, lecturer, and president of Strategies for Wellbeing, LLC. Did I get all of that right?
Good.
Welcome to Bounce Around Charleston. Ms. Garcia Williams, tell us what we're going to talk about today.
Today, we're going to talk about MEDI Mondays. And MEDI Mondays is a collaboration that we started with WJNI and our host, Terry Bass, to share with our community bits and pieces of information concerning the COVID pandemic. It's hard to believe that we started this effort about a year ago. So we're in the process of celebrating the annual observance of that show, along with our first guest that we featured on MEDI Monday.
Okay, so how is the collaboration going?
I would say the collaboration is going quite well. We started this sort of just on a whim of sorts. As you know, Terry Bass and I have worked together on several different projects, and I kind of lean on him in a lot of cases saying, Terry, we got to do something. And we talked about doing something beyond those initial collaborations. And this MEDI Monday concept is one that has really worked well. We join with his listeners every Monday at 9:30 a.m. And it's about a 20-minute segment, but it gives us an opportunity to share information with listeners specific to COVID, what we can do, how we can better manage it, what our community needs to be aware of. And we've been able to do this with a lot of very important and insightful guests.
Well, why don't you tell our listeners again exactly what the MEDI Resource Center is all about?
Okay, the MEDI Community Resource Center is a 501c3 nonprofit. We're based here in North Charleston, but the idea is that we are created as a tool or resource to support our community where the needs are greatest. Many times we focus on the areas of what we consider to be social determinants of health, and where we live, how we live, the access that we have to resources can have an outcome on our overall health. So what we try to do is to mitigate some of those issues and provide for our families, if you will, or the community that we serve, the resources. Resources have existed for quite some time, but we use an electronic tracking tool, which allows us to be able to not only connect them to the resources, but also to confirm that they have in fact received them. So technical support is one that we provide in providing the resource through the technology that we provide through the platform. But we also provide an educational forum, we share information, and again, following with the MEDI Monday concept, we're providing listeners with the value of other professionals outside of the area that we typically don't have access to. So through MEDI Monday, we're expanding the mission of the Community Resource Center to share and recognize and engage those listeners with those individuals that can best support them.
Okay, thank you so much. So, Brother Terry Bass?
Yes, sir.
Tell me about your part in the collaboration.
I just do whatever she tells me to. But, as she said, with the pandemic, obviously, these times are not normal. Mm-hmm. And you can't expect to do the same things that you would do in a normal situation. As we know, what they say, the famous genius said, to do the same thing expecting a different result. You know what I mean? That's insanity. So we had to do something a little different. And radio's foundation has been being able to give help and information in a time of crisis. And that's exactly what we are still in, a time of crisis. So it's been a great 20-minute conversation every week that I don't know of any station in America that are doing something consistently every Monday when people start their workday, whether they're teleworking or whether they're now back in the office. But it's information that hopefully can help them navigate through this most peculiar season that we find ourselves in. And I think a year later, obviously, it has proven itself value because we're still doing it, and it's still something that we probably will be doing throughout the balance of 2021.
Okay, thank you, sir. And Mr. Glenn Ellis Sr., I see that you definitely deal with health issues, educating people about health. Tell us what your role is in all of this.
Well, my role in educating people around health is tied to the kind words Garcia said about my being a lecturer and a researcher and a columnist, syndicated columnist, excuse me, a radio personality, or host rather, and also I do radio commentary. And I've been very fortunate to be a part of this collaboration, just in terms of the work I do. So, for the past 20 years, I've been doing a lot of hard, on the ground kind of educational efforts, particularly for our community. My background, I'm a fellow at Harvard Medical School. I'm a visiting scholar at the National Bioethics Center at Tuskegee. And so this is what I do. This is my calling. And so I feel a sense of ancestral type of obligation to do everything I can to empower our people with information. And particularly as we're seeing now in the vaccine campaign, the majority of us are making decisions about getting a vaccine out of fear. We're not informed. We don't have a comfort level. If we were getting ready to buy a car and our car broke down that we use to get back and forth to work, we wouldn't just buy a car because somebody said, buy this car. We're going to do our research. We're going to look at what our money will, how far our money will carry us. We're going to look at what kind of flexibility and functionality. We're going to do all of those things before we make the investment. So now we're being put in a situation to make an investment into our very lives without having proper information. Reverend Miller, I wrote a weekly column for the last 20 years that's syndicated throughout the Black press in this country. I wrote the first column January 29th, shortly before coming onto this inaugural program. And I wrote that column and I said, hey, y'all, there's something going on in China.
Okay.
And I know enough about virus and immunology and epidemiology to know virus is coming here. And this don't look good, and it really ain't gonna be good for Black people. So that was January 29th. Every single week since then, I have written a weekly column about that topic, looking at the vaccines, the test, every aspect of it to make sure we have as much information as possible. And that is something we haven't had the luxury of thus far. And it's playing out in terms of what we're seeing before our eyes, in terms of the disproportionate burden of this disease that our community is carrying. And Reverend, I'm gonna say something just to show you how entrenched it's really systemic racism that we have to, Iyanla Vanzant says, you got to call a thing a thing. There's systemic racism in this country, in our medical and healthcare system, which is the course of this conversation. Now, what most people didn't think about, when the first guidelines came out from the CDC last year in March or February, whenever it was,
Okay.
they said, Reverend, if you think you got this, do not go to the hospital. Don't go to your doctor's office. Call your doctor and they'll tell you what to do. Do y'all remember that?
Right.
Yes.
The facts are most Black people in this country don't have a doctor. So the systemic racism in this healthcare and medical system totally overlooks our value and our needs. And I'm encouraged because we've been in this country for over 400 years, involuntarily be brought here. And all of the stuff that's gone on in this country, and we stand, we know how to survive. And I was on a radio program. I started my day. I didn't want to tell Garcia this while she was sitting there laughing and having fun. I had a 4:00 interview in California this morning. So I've been going since then. But the thing we have to understand right now is that if we look at all of the numbers, look at everything that's going on, how in the world can it be that in the most powerful country on the planet, with the most expensive healthcare system in the world, they're still trying to figure out how to get vaccines into Black communities. Elon Musk sending spaceships to Mars. And
well, you know, it's amazing that you were talking about this, because talking to some of my colleagues, they have been talking about, especially in the rural areas, how the Black churches, we must get involved to get the vaccines to the rural areas, because a lot of our members, they don't have transportation to get to the places where the vaccines are being given. And then on today on the news, if you listen to the news, everybody was waiting on the Johnson & Johnson, the one vaccine. I know I'm in that group too. I was waiting on the one and not the two. And I did the one. And now there's this pause on the Johnson & Johnson because of the blood clotting. What this does in the national news, folk that were afraid to get the vaccine from the beginning, now they're really making a decision, should I or should I not? What do you say about that?
Well, let me say a couple things real quickly so that we can all have an opportunity to weigh into this. So the first thing I say is we have to understand one very fundamental thing. Ain't none of these vaccines approved. Pfizer, Moderna, or Johnson & Johnson. Listen carefully. They are not FDA approved drugs. They receive something called emergency use authorization. That's a little clause that's in the FDA regulations that's only there. And by the way, I've been on IRB's boards for the last 15 years, doing nothing but approving or rejecting scientists and researchers who want to do research on vaccines and stuff. So I was first taken aback when they said they could do this in less than a year. And I know that it's a minimum of 3 years, most like 5 to 10 to do a vaccine. So I said, okay, I'm gonna let them have that. But anyway, so it's emergency uses. If I was in the hospital right now, Reverend, and I had a terminal disease, they done throwed everything at it but the kitchen sink, and they can't, nothing else they can do to help me. Then they hear that Dr. Terry Bass Bryant is doing some research over on the other side of town on this same little rare disease I got. And they just getting started and they trying to get ready for the trials. And so my doctor, Dr. Garcia, and don't blame me because I was desperate. I had to get somebody to be my doctor. So I just said, I'll get Dr. Garcia. I asked her, is there anything? She said, Glenn, there's nothing we can do except Dr. Terry. They're working on some research. She can apply to the FDA to say, hey, listen, there ain't nothing else to help. This guy is hopeless. They say, okay, here's an emergency use authorization. That's just the best thing that can happen is that it will give them some information that they can use to carry on the rest of the research. So basically, I say all that to say, we're part of a clinical trial right now. They have no idea. You cannot point to anybody. And we just heard Pfizer say that theirs is good for 6 months. That's only because they've been tracking data since 6 months they started giving it to people. It's not because they know anything. So just the limited data they have from the people that's got it so far, they said, well, it must work. It works for 6 months. Well, does it work for 7 months? Does it work for 8 months? Ain't nobody talking to us about this kind of stuff.
So then my question is to you, Garcia, Terry. So what do we say to the public? And they're all concerned about whether we should follow through with this or not.
I want to say, I'm going to turn it over to these two people real quickly. I want to say this. My quick answer, I think we need to tell people, like I was going to tell you about this lady I talked to on the radio this morning. I asked her, where did your granddaddy get his PhD? She said, what? My granddaddy was a sharecropper in Louisiana. I said, what was the common sense and the gut wisdom that has allowed our folks to survive for 400 years? Now, if anybody stops and thinks about it, 4 weeks with a mask in this country will destroy the virus is gone. All you got to do is for 4 weeks, if everybody just wore a mask.
Right.
So this ain't the kind of crisis that this is a convenient crisis because we're the only healthcare system in the entire developed world whose healthcare system is tied to the free market.
Okay, we're gonna put a hold of that as a second.
Okay.
Something I say I need to take a break because we got to pay bills. So after this break, we're gonna come back and continue this conversation right after this break.